everyone. I'm Melty, and I'm going to be doing Paraffin Bath. Um, just to explain it, it's a thermal modality. It uses hot wax to provide primarily heat to the hands and feet, the external extremities. Um, all you do is you turn on the tub of heat, and you just put a block of wax in here, and the tub will actually melt. Will actually melt the wax, and it's going to heat it to 126 degrees Fahrenheit and keeps it at that temperature consistently. But there's a chemical in the wax that actually makes the patient not feel as much heat. So it really only feels like it's around 100 degrees. Um, Psychological responses, uh, tissue therapeutic increases, pain relief, and thermal hypothermia occurs. Indication, contraindications, it decreases range. Indications are decreased range of motion, muscle guarding, muscle spasm, and infection. Contraindications are impaired circulation, skin anesthesia, and open wounds or skin infections. Um, Another indication is subacute and acute injuries, or injury, pain, or swelling. The precautions, so you make sure that the athlete doesn't touch the bottom or the coil or the heat coils inside, and the application technique. Make sure you have towels available, a bag, and some tape or light plastic. Um, there's four ways to do it. The one we're doing today is dip, dip, dip and wrap, dip and wrap technique. The others are dip immersion, um, paint method, and uh, and yeah, and just the immersion method. Um, well, we explain what the method is, and we just have to make sure the athlete's comfortable. We're doing hand today. Make sure the athlete washes their hands, and he's already done that. Um, you actually want to guide the hand into the paraffin bath instead of just having them do it. And the way we do it is we go top to bottom, and it's around 7 layers, or just as much as they can withstand. So you have to take the patient's hand and just keep it up so that they don't touch. And I'm just gonna dip and let it drip and dry. Good. You gotta go high, a little high. And after you apply the 7 layers, you put their hand in left leg, and you just secure it at the wrist to keep all the heat inside. And then wrap it in a towel. The treatment time is about 20 minutes, so he's going to keep this on just to keep all the heat inside for about 20 minutes. Um, you also make sure you ask the patient if they feel uncomfortable or anything to just let me know. If it gets too hot or unbearable, or if it starts hurting, then I would just take it off. Um, just let it sit for a few seconds. After 20 minutes is done, just take it off and unwrap it. And just because the modality is pretty expensive, you don't want to just get rid of it. So what we do is do is we just peel the wax off so that we can just dip it back in and reuse it. And before you dip it back in, you want to just pat down the inside for any sweat and just crumble it up in a ball. Just drop it back in. And the wax will just remelt it and it'll just become part of the paraffin bath again. Uh, you make sure you want to check the skin for any irritation or allergies or anything. And basically wash your hands and that's about it. Make sure you ask how the athlete feels and advise any exercises for further treatment. And that's Paraffin Bath. Thanks.